to the Hair Society, beginning at the age of 35, the majority of the worldwide population will begin to experience hair loss. Joining us now is plastic surgeon Dr. Ben Stong with some helpful tips and a solution for hair loss. Welcome to Bloom, Doctor.
Thanks for having me, Gail.
So, Doctor, what is the biggest cause of hair loss in men and women?
It's actually the same cause in both men and women. It's a genetic hair loss. It's a sensitivity to testosterone. Women have testosterone just like men do. And it's a sensitivity to a byproduct of testosterone breakdown called DHT, and that causes the hair loss. And it's the same in both male and female pattern hair loss, just happens to be way less common in females.
So what are some of the non-surgical things that people can do to prevent hair loss?
Yeah, absolutely. So minoxidil over the counter is one. Finasteride or Propecia is another. That is a DHT blocker, and it's also in a pill. Versus we can also get it compounded into a topical. There's some vitamins; those are marginally helpful. There's like light-based devices that you can wear, marginally helpful. But really, it's finasteride, minoxidil, and then on top of that, the gold standard for non-surgical hair loss at this point is platelet-rich plasma with ACell. PRP or platelet-rich plasma takes your blood, spins it down, grabs the growth factors and platelets, and then injects it into the scalp. We add ACell, which is a derivative from pigs that makes stem cells as a stem cell stimulator. And then we re-inject all that concoction back into the scalp. We do 4 treatments over a 1-year period, roughly. And that improves not only the hair loss, but can get regrowth of the hair in the scalp as well.
Oh, that's great. And the before and afters are really impressive. What about our diets? Can that impact how much hair we lose?
Marginally. I mean, in a Western society like ours, having dietary deficiencies is extraordinarily rare. Of course, if you go get a hair loss workup, they might test for dietary vitamin deficiencies, but not really. I mean, even if you just take a multivitamin a day, that can help. But biotin is the main thing that people use to, from a vitamin perspective, to treat hair loss.
What are some popular hair myths?
That hats cause hair loss. Hats do not contribute to hair loss. That it's from your mother's father. It can be from both sides of the family, doesn't matter. That's also an urban myth.
Okay, I was just about to ask you about the genetics, so you just debunked that one. I mean, it can happen on either side, right?
Absolutely, right, exactly.
So when all else fails, what are some medical or surgical solutions?
Yeah, so the final solution for hair loss is going to be hair transplant. The only limitation to hair transplant is how much of a donor site you have. The donor site is on the back of the head. We shave the back of the head to grab the grafts, and then we move them where we need hair. It's really that simple. If you do not have enough of a donor site, then you can't have a transplant. We don't move all the hair from the back of somebody's head to the top. That would be a weird hair loss pattern. But you can reliably decrease the density on the back of the head by about 15% without causing noticeable thinning.
I want to talk to you a little bit about women, because I know men struggle with hair loss, and you say they struggle with it more than women do, and I'm glad there are hair loss solutions out there for the guys. But when a woman starts losing her hair and it starts thinning, it really is traumatic, because for us, bald is not beautiful. So are you seeing more women come in for treatment?
Absolutely. I didn't want to make it sound like men struggle more. It's more common hair loss in males than females, but quite frankly, my female patients are the ones that have the most psychological stress from their hair loss, and it's a truly devastating problem in women. And the solutions are the same for both men and women, non-surgical versus surgical. So we get plenty of women coming in for PRP with ACell injections. Sometimes I'll prescribe finasteride if they're out of childbearing years, because it can cause birth defects. And then if those things don't hold them or get them where they want to be, then you got to do hair transplant for them.
All right, Dr. Stong, it's been great catching up with you. Thanks for joining us on Bloom.